بسم الله الرحمن الرحيم. السلام عليكم. I am Professor Adam Ahmed Adam. You are welcome to this mycology lecture. It is about mycetoma. Mycetoma is one of the subcutaneous mycoses. It is a chronic granulomatous infection involving the skin and subcutaneous tissues. It is characterized by the trait of one, slowly growing painless swelling; two, multiple sinuses, that is to say, openings in this swelling; three, discharge containing colored grains, the discharge from the sinuses. And you see here, this foot with mycetoma, it is swollen with multiple sinuses, and these sinuses are discharging the discharge that you see. Mycetoma in the foot has been known as Madura, and it is so named after the first place where it was described, and that was in India. The sinuses discharge, and the discharge contains grains. These grains are small particles which are colonies of the pathogen interspersed and matted with body tissues. They have got colors, and the color of the grain depends on the causative agent. Those are different colors. The color of the grain may be black, as you see here, red or brown, white or yellow, white, or pale. Transmission, how the infection is transmitted. The infection takes place by traumatic inoculation. So there will be a trauma where skin or mucous membrane injury, and through the injury, the pathogen will enter. And this trauma is commonly found in the foot, and it may be just a thorn prick. I would like to mention here that mycetoma is not contagious. That is to say, it cannot be transmitted from one person to another. The pathogens are found in soil, water, and vegetation. So you see here, the colored arrows are pointing to the possible reservoir of the pathogens. Any site in the body can be infected, but the vast majority of cases are found in the foot, more than 2/3 of the cases. Because the foot is the nearest part of the body to the areas where the pathogen is found, and the disease is common in people who walk barefooted without shoes. The incubation period of the disease ranging from 3 months up to 9 years. The incubation periods is the duration of time starting from the time of infection up to the time of the first appearance of the clinical disease. Mycetoma is classified according to the causative agents. There are two groups of pathogens that cause mycetoma: fungi and actinomycetes. So the mycetoma is classified into one eumycetoma, And this is caused by fungi, different fungi. And this Mycetoma constitutes about 40% of the mycetoma cases. Two, actinomycetoma, and this is caused by actinomycetes, which are bacteria. It constitutes about 60% of mycetoma cases. The two types of mycetoma are clinically similar. So clinically, they have the same clinical manifestation. We come here to mycetoma and the colors of the grains. Eumycetoma, the fungal mycetoma, uh, the lesion may discard black grains. And we are going to give examples of the fungi that cause mycetoma discarding black grains. The list is not exhaustive. Madurella mycetomatis, Madurella grissii, Leptosphaeria senegalensis, and the list is long as I have just mentioned. And also fungi can cause white or yellow grains. Example, Acrimonium falciforme and Aspergillus nidulans. We come to actinomycetoma, caused by actinomycetes, which are bacteria. Some of these actinomycete may cause stoma discarding red grains. The example is Actinomadura palateri. White grains, Actinomadura maduri. Yellow grains, Nocardia brasiliensis. White to yellow grains, Streptomyces somaliensis. And still the list is long. The clinical course of the disease, the mycetoma starts as a small pellets, subcutaneous swelling. It increases in size slowly over a year or more. So it takes a long time to manifest clinically. It forms sinuses on this swelling, and the sinuses discharge. The discharge containing colored grains according to the causative agent. In the advanced cases, the lesion may erode the adjoining tissues, skin, muscle, and bones. And there may be concomitant secondary bacterial infection. So the sinuses may be infected by bacteria. And I would like to mention here that mycetoma does not subside without active treatment. So it does not stop if not treated. Diagnosis. Clinically, mycetoma is obvious. But the most important after the clinical diagnosis is the etiological diagnosis, to know the causative agent. Because, as you see here, number 0, etiological diagnosis is important because treatment option depends on the causative agents. So if you know the causative agent, you can choose the right treatment. Then after the clinical diagnosis, you go and take the discharge, and then you clean the grains and you identify the color of the grains. The color of the grains is important in etiological diagnosis. So if the color is black, this is caused by a fungus. If it is red or brown, it is caused by actinomycete. But if the color of the grain pale, white or yellow, this may be caused by a fungus or an actinomycete. So you'd like to know which is which. Then you take the grain itself. After identifying the color, you crush it. You divide it into two parts, and you can look under the microscope after you add a drop of saline so as to see the structures, the branching filaments in case of actinomycetes, and the septate hyphae in case of fungi. Then you can make a film and dry it, stain it with gram stain. The actinomyces are gram positive, so they look as branching filaments. And then the remainder of this part, you culture it in brain heart infusion agar, which is a bacterial growth medium. The other half, you can stain it with gram stain, and it is gram negative septate hyphae if it is a fungus. And then you culture it in subrode medium. Culture that part in subrode medium, which is a fungal growth medium. Other tool of investigation is the histopathological and cytological diagnosis. You can take a biopsy or a cytology and you process it in that line, and then you see the histopathological changes. Then you can use molecular technology. You take a specimen and you investigate it through the PCR, polymerase chain reaction. All of these procedures, you need an etiological diagnosis to know what is the causative agent. Is it a fungus or a bacterium? Treatment, after knowing the causative agent, a fungus or a bacterium, you choose the right line. In case of mycetoma caused by fungi, you can give the antifungal drugs itraconazole, ketoconazole. In case of actinomycetoma caused by actinomyces, you give the antibacterial antibiotics such as streptomycin, cotrimoxazole, dapsone, and rifampicin. There may be a combination of drugs for a long time, maybe more than a year. Still, there are other drug treatment protocols. And you may resort to surgery, surgical intervention in case of drug treatment failure. And this intervention may be surgical cleaning or even amputation of the limb. After successful drug treatment, there will be the progression of the disease stops. So no more progression in the disease. And the sinuses heal, but the deformity persists. So now you compare in this picture the left disease foot after successful treatment to the healthy foot as you see here. The deformity is there. prevention, protection against injuries to prevent the infection. Then, early diagnosis and treatment. This will be a good thing. By this, the lecture is over. I hope that it is understandable and I wish you all the best.